Hello, my name is Dr. Tif Siragusa. I'm board certified in general surgery as well as vascular surgery, which deals with the treatment of arteries and veins. I founded and serve as the medical director for the Vein and Vascular Center of Nashville. 2 years ago, we were selected to be a regional training center for the venefit closure procedure for the southeastern United States. This means we instruct and train other physicians from around the country in our vein treatment techniques. I've been caring for patients with vascular problems in Middle Tennessee for 7 years now. How do you test for peripheral arterial disease? Peripheral arterial disease, or PAD, is a problem due to blockages in the blood flow to the legs. This problem develops as plaque builds up in the arteries of the lower extremities, restricting blood flow. The simplest and often first test that we use to detect PAD is called an ankle brachial index, or ABI. This test is based on the fact that the blood pressure in your arms should be the same as the blood pressure in your legs. To do this test, we first measure the blood pressure in your arms. We then measure the blood pressure in the legs and compare the two. If the pressures are equal between the legs and the arms, then there's no significant peripheral arterial disease. If, however, the blood pressure is found to be lower in the legs than it is in the arms, then that tells us that there's some kind of blockage going on and that we need to get further testing. The test that we typically get to further evaluate a patient who's been diagnosed with PAD is a CT angiogram. This is a test that uses IV contrast dye and an X-ray machine that gives us three-dimensional images of the patient's blood flow all the way from their chest down to their feet. This test is much more specific, and it gives us information regarding the location and the degree of the blockages. If the patient has evidence of high-grade peripheral arterial disease on this test, treatment is often recommended.